When I started at Nashville General Hospital about 8 years ago, we recently implemented a new system. Like within a few months of me coming, they had already implemented a new system. So our product was never quite mature enough, and it didn't work very well. We struggled a lot at the very beginning with how our nurses had to document pain. And there were at least 3 different places where they would document pain, and they didn't integrate with one another. So the nurses had a hard time going from nurse to nurse, from department to department, understanding what the patient's pain was. But our biggest challenge was our upgrades. Our upgrades broke our hospital. We have physicians who are still doing workarounds from the last update. We lost faith in our product behind our upgrades. We went from a partially integrated system to a system that was interfaced to the hilt. We had multiple vendors come in and do demos. From the very first set of demos, our end users were very happy with the product that Cerner presented to us. As we compared vendor to vendor, Cerner always came out on top. From our nurses to our ancillary division to our ambulatory clinics, Cerner was head and shoulders above every other vendor. We really wanted to make sure that our users had a say in this selection. We wanted to make sure that we chose the product that they were most comfortable with. This was one of the things that was ranked very high with who we chose. We wanted to make sure that our users felt like they were part of the solution, part of the selection, and that they felt comfortable with the product that we chose, and that they had trust in the product that we chose. The interface between our inpatient system and our ambulatory system never worked as advertised. We did multiple workarounds to ensure that information crossed from one system to the other. For example, we registered patients in our inpatient system, waited for them to interface into our ambulatory system, and we had users who just didn't follow the process, which broke many connections in how our end users received data. So if we had a lab that got put into the system under a patient that was not registered correctly, then the results never crossed back to the doctor. We spent a lot of time working reports to see where things didn't cross appropriately. So a lot of time is being spent on exception reporting instead of having a product that works seamlessly. We are really looking forward to one patient, one record. As we looked at systems, the more interfaces it had, the less likely we were to choose them. So we chose Cerner because of the integration, because they had a more complete solution than any other product that we looked at. The relationship between our organization and our vendor is very important. This was something that it really came down to the end of our search that was one of the most important things. We had to make sure that we didn't have a vendor, but a partner, somebody who was going to be in the trenches with us. So when we looked at different systems, we could check the boxes on functionality and technology, but we had to feel like the vendor of choice was going to be in our corner. It was really important for us to understand how well Cerner worked with other organizations. We were blown away when we did our site visits at how the Cerner team really worked within the hospitals, how they knew each other, how they had a great relationship, and how they had a great partnership. We're very excited about our partnership with Oracle Cerner. We're looking forward to implementation, and we are ready to get started. We are very excited to partner with Oracle Cerner, and we can't wait to get started.